Hello, 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 hello. It is hot in here, I'm telling you. Listen, I got the air on, I got the air conditioner going, the fan, this fan. Anyway, I don't know where y'all live at, but it's like 97 here right now. It's like 8 o'clock hours there. So, what's going on? What's going on? So, some of you guys who have questions about tests and exam and stuff, don't forget to go on Amazon.com and go get that book I just finished. That's the medical terminology book. Let me make sure y'all can hear me. That's the medical terminology book, okay? And that book has questions and answers in it, okay? So that's if you want to test yourself. It has questions and answers in that book. Go to Amazon.com and you can find that book, okay? Let me refresh this page. We were on looking at, whether the CPT book was on sale. So we were looking at the Amazon site, wee hours in the morning, and I'm trying to share my screen. We didn't see really anything. I mean, if you guys want to do I'm gonna share my screen right now. If you guys want to do the ebook, you can. You can do the ebook until you're ready to get your hard copy because you're gonna need the hard copy when you do your test. Okay. So see, yeah, we were looking at it and it's still $137. So we're trying to wait till it kind of pop down. It's like 6 months into 2025, so I thought it would have went down a little more. But again, here, this is your series 2, your medical terminology. There's tests in this book. Okay, so make sure you guys get that book. Okay, there's tests and quiz in this book. Go to Amazon.com. For these books, the books that we are using right now, I want you guys to go to Elsevier.com. Whether you're in the class, whether you're out of the class, whether you are teaching yourself, these are the books that you're going to need. Go to Elsevier.com, and in my description below tells you what books you need for this class. Set a time for yourself. You guys do know I have a schedule to help you out, okay? If you need to, you need something to follow along, you need something when I come from work, I want to do an hour, I want to do 2 hours, I want something to just kind of follow me along, let me know. I can shoot that over to you. More than likely, that's probably in one of my chats. I put a lot of stuff in my chat, especially that has to do with you guys learning with tests and with quiz and with schedules and syllabus. So, last week we went over the syllabus with you guys. So this is YTU I'm talking to. Those of you who are doing the Sapphire classes, you already have those things, but I have converted classes to YouTube. So even if I'm not on, so the goal is for me to do my 3 days. But my hours have gotten so hectic, I can't even get back in here in time enough to get that chat in. So I have to do it when I can. So when I'm not in chat, I still want you guys to go ahead and archive your courses, archive the class before. Don't forget, you want to go to the playlist. The playlist where medical billing is the medical billing and coding virtual course. That's the medical billing class. The whole class is in there. The medical terminology class is in the medical terminology playlist. So being that you guys some of you are starting from scratch and some of you are starting without me, that is fine. I can see that there are people who are viewing some of the archive videos. Just make sure that you get the books that you need, and that's fine. You do not need to follow along with me if you start at a different time. That's fine. These chats are made for you to follow how you want to, okay? Not how I do my chats. I make sure I specify the chat class number so that when you do get ready to come into the class, you know where we're at. I'm gonna drop the books up real quick so you guys can see the books. Okay, these are the books that you need. Some of you who are new to coding, these are the books. You guys know how I start my class. I always try to give a little bit of information. Okay, that's your Hicks Picks book. You're gonna need that book. Okay, and these books is what you need for this classroom, and also what you're going to need to take your CPC. That's your medical insurance billing books. That's your step-by-step books. We have not gone into this class yet. This is your next class, okay? The playlist for this will be coding, strictly coding, nothing else, okay? That's a medical terminology book. That's what we're in right now. So that's pretty much the books. I just want to kind of give you guys an insight on what books that you're going to need to do the course. Now, I know that there's been, I don't know if it's layoffs or people are just resigning. But you guys know I'm on Twitter forever, and that's what I see. That's what I hear. But if you are, now is a good time for you to take a class. Now is a good time for you to probably learn something else. Like I said, there are a lot of facilities that have either downsized or have either closed. And they're looking for the billers, they're looking for the coders. They're looking for managers. They're looking for revenue cycle. I have people who call me all the time for, revenue cycle director, this, that, this. And I know they need somebody to take care of their finances, the accounting. The girls have to have guidance. I'm sorry, girls and guys have to have guidance when you are working in the billing department. We can't just put you in the billing department and you have no go-to. You can't have a billing department and you have nobody to ask a question to, especially that you feel comfortable asking a question to. So there are a lot of doctor facilities looking for the medical billing managers, the coders, etc. Especially the physician offices, because remember, physician office, they can pretty much do what they want to do. I mean, they write their own rules. And a hospital, especially, accredited hospitals, they have rules to go by. So, you want to be a little bit more, you want to see hospitals are a little bit more stricter than they are physician offices. So that's up to you. When you first starting out as a biller, which way would I go, Ms. Lambert? I technically would start with a hospital. And I'm not saying that because the hospital is a little bit tougher. I'm saying that because there's going to be a lot of women in there, a lot of men in there that are doing different things. And I would rather have you touch points on different things than kind of go in the physician office and you're doing strictly one thing as far as accounts receivable or something like that. Now, depending on the facility, you may be the biller just doing everything. I saw something where, they wanted the biller to know, credentialing and this and that and payables and all those stuff. Billers don't do credentialing. Credentialing is a whole different department. Now, that, if you're in a physician office, you hand in hand with your physician. Y'all gonna work together. You want to learn everything. Annie Mae gonna learn everything that she can because that's her doctor for years. She's been working for him. Okay, but in the real world, you're not gonna do credentialing. Credentialing, there is a credentialing department. If he's gonna pay you double to do credentialing, okay, because that's another headache. So, you can't tell me, I had a conversation with somebody the other day, and it's like, no, you need to hire a credentialing person. Either if you hire a biller, she's got to do credentialing. I think you need to pay her a little bit more money. And either that or go ahead and get you one that's actually certified. There are certifications for credentialing. Yes, it is. AAPC has everything. So, when you come to the physician office, it's a little bit different. But again, if you're brand new, I would start at the hospital. Try to get into one of the hospitals. Let's see. What else did I get? Miss Lambert, what kind of resume should I have? Okay, your resume should have your school on it. Your resume should have whatever you need to have on there. Okay, to get you that job. So long as you can answer those questions on what you put on your resume, do it. Okay, do it. If you've been in Sapphire Physician Coding for 6 months, if you've taken that 40 weeks class and you finished, put it. If you're in a Sapphire class, I don't care if you're in YTU, you taking classes on YouTube for medical insurance billing. Put it on there. And they're still going to give you, a couple of questions. They're going to give you a test about medical insurance billing. Some of y'all already did medical insurance billing already, so you should be called medical insurance billing. What you're going to do is go over those chats. Make sure you have your medical insurance billing book. Okay, make sure you have that book. Okay, because that's what's going to help you get that job in medical insurance billing. And coding, you're going to need the medical terminology that we're going over. So some of you who are already in the Sapphire class, you already know what we're getting ready to do. Some of you who are going to the next level to actually take your CPC, that is wonderful. Just keep on going. I'm going to get I was going to get another hard book, but I think I'm going to try and do the ebook. I don't know how much of that I can show, but I know I can show up to musculoskeletal system on the Kindle. But I'm going to get another, I'm probably going to get something else for you guys because I need to show you things that are in the book. And I can't show you. Y'all know I'm not opening the book and I'm not going to do that. Put the book up to the camera. I'm not doing that. I'm going to get another ebook, and we're going to specifically use that ebook for you guys. So I'll have that CPT book for you guys so that I can show you those codes. So when we get up to y'all's coding class, I will have that. And you guys have plenty of time. The coding will not start until probably September. August is probably the 15th of September. We're going to be finished with medical terminology. So I'm hoping you all have your coding books by then. We're getting ready. We're going to dive into coding. Okay, we're going to dive into the coding. And y'all know how we're going to do it. We're going to go step by step. Y'all know how this is a beginner class. This is not an advanced class. We show you how to do what you need to do and how to decipher the codes. Why are they coding? What are codes? What is 7 digits for? Why do we need the 6 digit? What is a placeholder? That's where we start from. So in this classroom, I will start from the beginning with everybody. And then you are going to creep up to the more advanced. All of the classes, again, will be coded so that you guys will know what class you're in. If you missed three CLS coded 1, then you know you're going to go back to that. Okay, so I hope you guys have your medical terminology book. Let me get my screen shared so that we can go through medical terminology. Now, we went through cardiology last week. I always say last week. What was it, a couple of days ago? We went through that, and you guys know how I am with cardiology. I still want to do cardiology again, but I'm not going to make you do cardiology again. We're going to go over respiratory, like I said, we were, okay, because if I keep going over cardiology, y'all going to get tired of cardiology, and I love cardiology. So, and it's just a form of just seeing how the heart pretty much works. All right, so right now we are in chapter 12. So we're technically halfway through this course. We're technically halfway through because if we're on chapter 12 and you guys got 21 chapters or 22 chapters, we're halfway done, okay? So again, we are on the respiratory system. That little book in the corner is the book that you should have. Okay, so again, we are going to be discussing the respiratory system. So it is the same for all of the chapters. We do introduction, anatomy and physiology of respiration. In this chapter, we go over vocabulary, terminology, pathology, a couple of tests that they're going to do in this section. Same thing with the other sections. We go over some clinical procedures, abbreviations, a couple of applications, and exercises, okay? And we're going to talk about therapy for lung cancer and a couple of things like that. And it's just really putting you in the right place of what you need to study. And again, if you want to see what's on the AAPC CPC, go to aapc.com and take a look at that, okay? So let's kind of get started here. So the chapter goals in this book is the respiratory system and the locations and functions, okay? So in this book, which I hope you guys have the same book. This is a nice picture. I want you guys to see this picture. So that's a nice hefty picture of your lungs. All your respiration stuff goes on in there. Okay. So you guys should have the same book that I have. Even if you have a book that is a different year, you probably will have the same pictures. Okay. They may be on different pages. Okay. So this introduction to respiratory is pretty short. It's not as long as cardiology, but it's still very invasive. So when you guys get your book, let me go back. When you guys get your book, I want you to make sure that you take heed to a lot of these words that's in here, because I'm not going to go over all the words, but I want to make sure that you're in the right place. So let's say you say, Miss Lambert, I'm going to do my work after church today, and we're on chapter 12, and you missed, and you're still at church. When you get out, you're just going to archive this chapter. When you finish with this chapter, now you are going to do your test. There are exercises at the end of this that you would do. If you go on Amazon.com and get the Sapphire Physician Coding Series 2 Medical Terminology, there are 50 exams in that book. Your exam number 12, might be 12, is respiratory. You see how my book is combined with the medical terminology book? And it is to give you more of what you need. It is to give you more of what you need. So that's the reason why I want to make sure you get that book. So this is your introduction on respiratory. We usually think of respiratory as the mechanical process of breathing, the exchange of air between the lungs and the external environment. This exchange of air at the lungs is called external respiration. So that is what you guys will be studying tonight. That is what you're going to be studying tonight. If you have your, I don't have it in front of me, but if you have your index cards, make sure you take those words down that you just saw up on your screen. Okay, so exhalation, I want you to make sure you take that down. Okay, external respiration, take that down. Inhalation, take that down. Okay. So on this page, I'm on page 432, and I want you guys to make sure you read this portion down here where it says anatomy and physiology of respiration. Let me show you that, because this is a very important part right here. On your CPC, they may ask you the functions of the breathing. Even though it's still going to be open and closed questions, they still may ask you how that function goes. So how you're going to study that, you're going to relate it to your medical terminology book. Okay, that's how you're going to relate that question. The CPC will give you open and closed questions. Those open and closed, not the whole test, certain parts. These questions will give you multiple choice, and you'll choose which one is the correct one. And your respiratory system, for you to be able to retain, that information, you need to have index cards. Okay, and you need to go over this a few times. And I think that's the reason why I decided to put it on YouTube. Well, the classes. You still have to get the books and then the courses. Because the only way that you're going to remember what you need to do is to go over these chats. The reason why is because what's on that CPC is what's in the chats. The way that the chats are derived is what's on the CPC. So if we're in this chapter, anatomy and physiology of respiration and medical terminology, there will be a question on that. Even though there's only like 4 or 5 questions on medical terminology, we don't know which question it is. And you have to know medical terminology. I don't know what that is. Okay, so as you read the following paragraph that describe the respiratory organs, and we all know about the respiratory organs, okay, and their functions, because they're in us and they're in our body. We know what's going on. As you can see, you see me all choked up right now. That's what the air is on, it just kind of drain me out. Air enters the body. See, air enters the body via the nose through two openings called nostrils or nares. So if you have something like that on your exam, is nostril and nares the same thing? And or yes or no, A, B, C, D. Pick one. Okay? Air then passes through the nasal cavity lined with the mucous membrane and fine hairs, cilia. That's on your test. I'm telling you right now, they're going to ask you what that is. Okay, it's going to be multiple choice, more than likely. Okay, hairs to help filter out foreign bodies as well as to warm and moisten the air. There is an illustration. There's one in your CPT book. There's hundreds in here. We'll go over. Some of these are loud. I can't really show y'all. It's too just disgusting. But some of the cartoon ones, y'all know I show y'all. But take a look at the illustrations that's in your CPT book and your ICD-10 book and your Hicks-Picks book. Okay. All right. So we talk about the phonics. We talk about the nasal phonics. We talk about the pharyngeal tossals, adenoids. I want y'all to take all those down because you guys already have the book. This is why you need your book. Okay. Don't forget Elsevier.com. That's where I want you to get your book from. You can also get it from Amazon.com. Okay. The larynx, I want you to make sure you know what that is. Okay. The third division of the phonics is the laryngopharynx. Serves as a common passageway for food from the mouth and the air from the nose. It divides into larynx. What is the larynx? What is a larynx? Your voice box. Okay, and the esophagus. Okay, I can't read the whole thing because I can only read some of it. I have the rights to these books, but I'm not going to read the whole thing. Okay, I want you guys to read for your homework. Okay, this is an awesome illustration right here that you guys can use. I'm sorry, I have my phone right here, and I got it on quiet, and it still just goes off and goes off. Okay, so yes, I want you guys to take heed to that illustration because you still need to know it. Whether you're taking your test or not, it's a part of the medical insurance billing classroom to make sure that you know medical terminology. And you see how wonderful this book is? Things like this that are in this book that you do need to test yourself on. If we are going to go over the medical terminology in if I was in regular class, you guys would be doing this for classwork. So I will probably give you about 35 minutes to do this. And you will be getting these answers from this book. So yes, I want you guys to do this. And this is going to be based on what you just previously read. I'm not sure why that's like that. So yeah, this is based on what you just previously read. I'm going to take this down. So the medical terminology book that we're all going to look at will be the same book. Okay, it's not going to have anything to do with what we are talking about as far as medical billing. Okay, medical billing is medical billing. I got to push this down. Medical billing is medical billing. Medical terminology is medical terminology. Medical coding is medical coding. Okay, so there are 3 different classes. Look in the playlist, and it's going to help you. Okay, when you look in that playlist, it's going to say medical terminology. When you look in another playlist, it's going to say coding. The other playlist is going to say medical insurance billing. Okay. If you have any questions about it, just let me know, where you're at in it. Okay. I'm trying to catch some of these emails y'all are sending me now so I can go ahead and answer them. So if you want to do, let me answer. So if you want to do a 6-week course, you can do a 6-week course. The 6 weeks course is the same full long course. It's a crash course. It's for people who have 9 to 5 to study. That's what it is. people who have 9 to 5 to study. And some people have 9 to 5, 3 days a week. So they can do 10 weeks. Some people can only do class like 3 hours every 4 days. And then they do 40 weeks. Okay, so you have a 6, 10, 20, and a 40. I actually have four different schedules and 4 different programs because there's some people who do not want to do, um, you know, coding. Everybody knows medical billing. I told you I hit the streets and I kind of did like a survey to see who knew anything about coding. And coding is all over. Did you guys see the thing about well, it's not a thing, but like our ancestors and the blankets that they used to make so that they could have a way out. These blankets were made in codes. They were made in code so that we would know which way to go. I mean, coding is like, has been around a long time. And when we use the term code, it's not just for one thing. The basis of coding is to decipher something that you're trying to figure out, using a different route to figure it out. Use this route to figure that out. It could be coding in anything, coding numbers, coding words, coding maps, coding, the way you're going to run your day. You can code the way you want to run your day. I went out today, and you know what I did? I had notes literally stuck to my chest, so to make sure I don't forget what I wanted to get. Even though, because if I put it in my wallet and I'm in the mall, I'm gonna forget. So, and I had codes on it because the note was visible and nobody could understand what I wrote because I wrote it in code. Now, that's a whole different coding than the coding that you're learning. The coding that you're learning is turning words into numbers. You're taking full words and you're turning them into numbers. So if I walk around with 99215 on my shirt, nobody knows what 99215 is. Only I do because that's a code, right? So I'm writing on my shirt. Let's say I need butter. I'm going BXYZTUHRXEZB. You see what I'm saying? That's a code that I'm writing on my paper. Nobody can decipher that code if they don't know how to do the coding. Not medical coding. That's word coding. So you see, I got you. It's so many different types of coding. No, Miss Lambert does know several different types of coding. This one is your medical coding. And it's so crazy because, when I started coding on Twitter, I noticed people started to code words more because there's certain words that I'm not going to say on Twitter, certain words that I don't say, but don't take me there. I'm saying it. But coding, like I said, is more than just medical billing. It's more than just revenue cycle. Everyone should get into coding. My grandson also does coding. He does coding with the games. So coding goes a long way. And, you have an opportunity to take your time and study the material, get your certification, and work where you want to work. Work where you want to work. I know that sounds kind of crazy. When you need a job, you'll work anywhere. Don't get picky. If somebody call you to work at the doctor's office and he ain't got nothing but 3 patients, you going. You going. It does not have to be $99 an hour. You'll get there. Take that as experience. When somebody hires you, especially with no experience, somebody hire you right out of taking their class, and they only pay you $25 an hour, just do it. Just do it because think of it as a learning possibility. You guys know what I always say. Even if you're doing medical billing, if you're doing teaching, always have a second job on the side somewhere. I don't think I know any of my friends that don't have 2 jobs. I mean, I have 2 jobs since I was like 19 years old. And they changed. I stopped, they changed, but I always end up having 2 jobs. And I don't think you need to be, fearful of that. If you need one job for medical, if you need one job for just a training, take advantage of that. They don't have to pay you $1 million, but take it as you're learning something from that company, or you're getting something from that company. Um, and me and Q was talking about that last night, and Q is one of my girlfriends, but me and her be on the same page. But I'll tell you, as soon as I start going that way, she has a tendency to bring me back this way. But do what you want. Do what you want. But in this class, I want you to take your time, learn the material, go over what you need to go over so that you can get through what you need to get through. Okay, because we don't know what's going to be next. We don't know what's going to be next. Okay, so I'm moving on from that picture that I just showed you guys, and we are in respiratory. Don't forget to what I would do on YouTube is type in medical terminology, and so that it can give you guys more of an insight as far as a video that shows how the epiglottis works, how the glottis works. It shows different movements that you've never even seen before. They're like flaps in your throat, and when you talk, they open and close. They open and close. And a video will show you that. Live video will show you that. The other one, I gotta put a video on there. I gotta leave myself a note to make sure I put that video on there about that heart. But I actually have one in my chat. I think it does say cardiology on it, but I want to make sure I put that down. Okay, but again, if you want to see some live surgical surgeries that has to do with respiratory, that's what I want you to do. Okay, so I'm just going to give you this little piece right here: food entering from the mouth and air entering from the nose, mix in the pharynx. So if you got your books, I am actually on page 433. Okay, and 433 is just pretty much giving you a little bit of a view and an explanation of the epiglottis and some of this. Some of this doesn't show you what the phonics is, but it's probably at the bottom. The epiglottis and the flapper cartilage. I'm gonna show you that one real quick. That way you can just see where I'm at. So this is where I'm at in the book. But you guys should be on the same page with me. I wonder why they have that down there. That has nothing to do with it. Well, yeah, it does, because the lungs is like right over the mediastinum. Y'all heard me say mediastinum all the time. It's like right here underneath here. So they just have it in here underneath what we were talking about. On its way to the lungs, air passes through the larynx to the trachea. The trachea is the what? The windpipe. Trachea is the windpipe. Okay. A vertical tube about 4.5 inches long. Now, I don't know if CPC might ask you how long the windpipe is. It possibly might ask you how long the windpipe is. So make sure you guys take heed to that. A vertical tube windpipe is about 4.5 inches long, okay, and 1 inch in diameter. Make sure you guys go ahead and get that. The mediastinum, I can't say it, mediastinum is a space in the center of the chest, in the region of the mediastinum. I can't even see it. The trachea divides into two branches, the right and left bronchial tube. This is going to be on your test, all right, or bronchi. So bronchial and bronchial is the same thing, okay? Singular is bronchus. That'll trip you up though, so pay attention to that. Bronchus is 1. Bronchial is 2, okay? Erythrocytes, capillaries. You're going to take those words too, because you're going to get those words in your index cards. That's going to be part of your glossary. Even though they're in here, you're still using them as a as a study guide. Each lung is covered by a double-layered membrane called the pleura. The outer layer of this membrane near the ribs is the peritoneal pleura. And the inner layer closer to the lung is the visceral pleura. Now, we do study this, and I'm going to just show you where I'm at so y'all can be on the same page. It doesn't matter. I still want you to take these words, because you may, like I said, you may get that on an exam. Being that we're kind of breezing through medical terminology, um, you shouldn't have any problem with this summary. Do not forget that you have to do a summary after this chapter. So when we finish this, because I'm literally putting you in the right place, let's do X, Y, Z, and then you go to the next chapter. So when we finish respiratory, what should you be giving me? Well, YTU you can't give me, but you're going to do this too. You should be doing a summary. You should be writing what you know about respiratory, and you should be going back over this chapter. Every chapter that I do, I cannot go in depth of the chapter on YouTube. I can kind of roundabout. So that's what we are doing in the class with the YouTube. We're pretty much doing a roundabout, and a roundabout we're doing a quickie. So you're the one who's going to do the most of the work. I just need to make sure I put you in the right place. And again, that's the reason why I made the medical terminology book with the test in there. This must be with the test in there, so that I just remember something. I'm sorry. That's why I made the book with the test in there, so that, let me see, 130. Okay. And as a matter of fact, thank you for reminding me. It's in medical billing 12. It's also in there. So it's your class 12 in medical billing. I think I put it in there. Okay. The layout is in there of how the summary is going to go. And the summary is just going to just help you to retain that information. Okay. So you see how we're talking about the peritoneal pleura, the diaphragm, the apex, the helium. I want you to make sure that you retain those things, okay? Well, this is a good one. I'm gonna show you this picture real quick so you can see where that diaphragm is. See? You guys remember we were talking about that before, right? And then, again, this is just medical terminology, giving you a little insight on medical terminology. We talked about different chapters, but this still will give you insight on that. In the medical insurance billing class, you have to take medical terminology as well. Okay, so in this we talk about the diaphragm, how it contracts and when it relaxes. That's what you're going to do your summary on. You can pick whatever you want, but I just want to make sure that you are clear on this chapter. Okay, and it's going to help you. And those of you who are already in a class, in a medical insurance billing class, think of this as a study class for you. Okay. So they have, I like this order that they have this in. I like these positions they have this in. Nose, nasal cavities, pharynx, larynx, trachea, bronchi, bronchioles, alveolar, lungs, capillaries. I'm going to show you this because I don't think the CPC is going to have this, but it might have something. Why I can't get it? It might have something related in this order. They might say, give me the order of the lungs or what's in the lungs or whatever. But you see how this is right here? I want you guys to study that. I just repeated that. So I just want y'all to come and take a look at that. Okay, and my book is on page 436. Don't forget to go to elsevier.com for this book. Okay, and here's your vocabulary. This is what I was talking about as far as your vocabulary. All the words that you need to know as it relates to respiratory system is right here. So on your CPC, you don't know which part of the medical terminology you're going to get. You do know you're going to get 4 questions. You know that because it's on the APC website. But you don't know where they're going to take these 4 questions from, whether it's respiratory, cardiology, the neural system. You don't know where they're going to get these 4 questions from. So this is why I want you to make sure that you get these vocabulary words down. These words are from everything in the respiratory section and so forth. As we move on, each section that we do, I want you to make sure you have those vocabulary words, okay? And again, it's just getting you used to some of the hospital talk, some of the things that you're going to hear. Okay. And on this page, I'm on page 436. They have the definitions is here anyway. Even at the bottom, they got definitions down there. So this is your vocabulary: adenoids, apex of the lung, base of the lung, lower portion of the lung. From the Greek basis, foundation. You guys remember Greek medical terminology. The basilar means located at or in the base. Okay, adenoids, lymphatic tissue, and then nasopharynx, pharyngeal tonsils. They got all definitions here, but these words are much more trickier. They're gonna ask you that because you guys remember what I said. They're not gonna ask you. No, let me get back. They're not gonna ask you no off the wall questions. It's gonna be stuff that you hear on a regular basis. The gist of the test is to know whether you have studied those books, whether you have racked your brains and did the coding, whether you have racked your brains and read that book. Look, every single night, first thing in the morning, 20,000 series, start. 20,000 series, open your book, 20,000 series, just read it. The more you read, the more you know. The more you read the guidelines, the more you know. The more you look at those codes, the more you're going to remember them. I don't care if you get up Saturday morning, hit your CPT book, you hit the 50,000 series and start reading. Open that book. And you know what? When you take your CPC, you're going to be so par with that CPC. And again, it depends on how serious you are with passing that CPC. When you Saturday morning, you know you're not going to work, get your breakfast in, set your 2 hours. Hit your CPT book. Hit your highlighter and start. Hit Miss Lambert chat and start. Because when you take your test, it's going to be second nature to you. When you see those cases, it's going to be second nature to you. But you have to know your book. And that's what AAPC wants you to know. They want you to be able to recognize what's in those books. Okay, so again, that's your vocabulary that we're going to do. And we are on respiratory, and we want to make sure that we are par with that because you don't know if you may get that on your test. Those of you, again, who are not taking your CPC, you still need to be familiar with medical terminology in any course, in any medical insurance billing. Okay. No, we have decided not to do the customer service. I did the survey on it. Y'all don't want to do the customer service. But if you guys have any questions on customer service, just let me know. Okay. The customer service is a portion that they do in medical insurance billing. So a couple of extras that you get in medical insurance billing, I don't do. I mean, I can, but like job development and customer service, which is two different courses that you actually get with a medical insurance billing course. Even if you were in a college or a preparatory school, they would give you that. I am not doing that. We cutting the bases on all of that. I didn't even have to do 22 and 20. I don't have to do 21 and 22, but I just kept that in there in case we did get, anybody want to do the pharmacology portion. You probably won't get any of that on your CPC, but I put it in there. But again, we're already on chapter 12 and the medical terminology. So we are moving along in the medical terminology. So again, just, take heed to what you're doing. Okay. Your combining forms are also here. When we get to use your CPC book, your CPC guide, we will be using. Okay, we will be using your CPC guide. Okay, and in the beginning of your CPC guide, we will be going over some of the things you need for insurance billing or for revenue cycle management. Okay, in this illustration right here, you guys probably have this. I can't get the whole thing in here. I don't know why. I may have to break some of it off. All right, so that's good enough. Okay, so I did get the majority in there, but we just put it up for a quick second. So when you guys get to this page, I want you guys to make sure that you study that page because lobectomy, it sounds like something that might be on your test. Segmental resection, they're just kind of showing you stuff. Pneumonectomy, okay, and they're giving you a description of it. Oh, this is amazing. I want you to make sure you take heed to this picture. Okay. It's a picture, but it's also called an illustration. Don't forget elsevier.com. I want you guys to make sure you get that book. Okay. Now, a lot of y'all say you don't like the ebooks. That's fine. Don't get the ebook, but get the hard copy book. Okay. Because that particular illustration, the frontal sinus, ethmoid air cells, sphenoid sinus, maxillary sinus, that sounds like something that may need to be identifiable on your chest. Paranasal sinuses. These are four paired air-filled spaces in the bones of the skull surrounding the nasal cavity. Let me see if I can give you that. So when I say some of these illustrations might be on your chest, just kind of take heed to that. Okay. You guys probably can't see the whole thing surrounding the nasal cavity. Sinusitis is inflammation of the paranasal sinuses due to viral bacteria or fungal infection or allergic infection, allergic reaction. You see, this is the reason why I want you to make sure that you look at these illustrations because they actually go with the illustrations. This figure goes with that. Pneumothorax. We talked about this before with the pneumothorax. Make sure you guys take this down and look at this. I'm not saying it's going to be on the exam. It probably won't, but maybe somebody has a lung issue. Maybe somebody wants to know what that is. Maybe you want to know more about the respiratory system, and you can go in depth in the respiratory system. And your CPT book in the respiratory section, they go so in depth. It's just like reading medical terminology. When you go to your each section in your CPT book has guidelines, just like the CMS guidelines. Remember the CMS that I was showing you before? Right. They have guidelines that are like that in each section, even in the E&M section, all the sections, the medicine section, they all have guidelines for us to read. The respiratory section will have guidelines for you to read. Make sure that you read them. In addition to doing what you're doing now. That's why you guys remember when I said when you're doing medical terminology, have your medical terminology book open and have your CPT book open, have your ICD-10 here, and just keep them in the wind. But have your CPT book open and your medical terminology book open. The diagnosis is not going to be so hard to decipher as the surgery, because you could figure out the diagnosis based on the surgery. The diagnosis is the first thing that you're going to put. You could see the patient came in and the patient was XYZ, the patient so, the physician decided to do this. Now you got to decipher this. So the diagnosis will not be so bad. But the codes for the surgery, the procedures, that is what's going to get you. That's what you need to make sure that you par with. Because AAPC, again, they may give you a big case that's like this, and you're sitting there started reading in about 15 minutes, you're still looking at the same thing. That's going to be a problem. I'm not saying everybody has to learn how to speed read, but if you get to know your book, because you're going to use your own book on the test, get to know your own book, and you will be able to decipher that code quicker, much quicker. So, just take heed to that. And a nice, easy way for you to study is to have your medical terminology book with you and your CPT. Because when you open up that section in the CPT and you talk about respiratory, you can see you can give yourself an idea about the codes. So when you do your study time after me, like it's kind of late now. You guys know I do my class a little early, but when you guys archive this and you're ready to start doing your chats, and you're ready to start doing your studying, have those books open. Okay, have those books open. All right, I spent most of the chat on. We haven't even finished this whole thing. Percussion, plural warehouse, strident. Yeah. So this is pretty much just pathology stuff. But the basis of this is you get the vocabulary down, the terminology down. Okay. The pathology stuff will not be on your CPC. Okay. But they may ask you, definitions again. Cystic fibrosis, CF, chronic fibrosis, inflammation of bronchi persisting over a long time, type of chronic obstructive pulmonary disease, COPD. COPD may be on your test, so make sure that you know what COPD is. I just told you. Okay, chronic obstructive pulmonary disease. Okay. Um, we don't need to talk about the lung cancer, pulmonary embolism. That's PE. Make sure you take heed to that. Tuberculosis. Make sure you take heed to that. All of the definitions that you need are already in this book, so you don't need to get your dictionary. Okay, it's little invasive pictures in here. Okay, and I love the invasive pictures. Okay, I'm just going to head down and silicosis. Listen, so make sure you guys do this chapter. I'm going to switch over to the blood and let's see how much of that we can do. Basically, you're going to, that's your next chapter because we do normally 2 chapters. All right, let's see what it's about. So that's chapter 13, the blood. Okay, so normally we do 2 chapters, but again, you guys, this is what you're going to do tonight, or when you get ready to do your study, this is what you're going to do. Okay, for the blood system, and I don't think the blood system is that invasive. Um, and nobody gives me like any insight on something that may have been on, but you still need to know about the blood system, red blood cells, white blood cells. It's going to be on there. What is plasma? That we're going to be on there. Composition and formation of the blood. Blood is composed of cells. 45% of blood volume or form elements suspended in a clear straw-colored liquid called plasma. 55% of your blood volume is plasma. The cells are erythrocytes, red blood cells, or I'm saying or RBCs, leukocytes, white blood cells, or WBCs. Remember that. Okay, I'm gonna show you that real quick. So you're gonna study this at home anyway, but I'm just trying to put you in the right place. Okay, so that's what the gist is. Just put you in the right place. Okay. And when you read this, make sure you pay attention to the cells beginning at birth. All blood cells originate in the marrow cavity of the bones. Both the red blood cells that carry oxygen and the white blood cells that fight infection arise from the same blood forming or hematopoietic, y'all know I can't pronounce nothing, stem cells. Okay? I can't read the whole thing, but we got to a little bit of it. Erythrocytes. Erythrocytes. As a red blood cell matures, it loses its nucleus and assumes the shape of a biconcave disc. I don't know what to do. Like that little dip, like a pancake in a little dip. This shape, I don't know why they want to explain that part, allows for a large surface area so the absorption of gases is released. Really, I had no paying no attention to it. I thought it was just just an illustration, with the blood cells like that. Let me show y'all what they talking about. You see how the blood is. You see how these little cells are, and it has them little dips, so they're like it's a cup or something. That's what they talking about. I don't think it's necessary to describe that. I don't get it. I'm saying they do that. All right. But I just didn't feel necessary to describe that. But okay, just make sure y'all read that. Okay, so this book, read it. Okay, let's see. Let's move on down. Stages in blood cell development. All right, so I'm not going to read that whole thing because it's a lot there, but I do want you to read it. Is the hemopoiesis, okay? All blood cells originate from hemopoietic stem cells, which is pretty cool. Erythroblast, lymphoblast, segmentoblast. We didn't do leukocytes. We can do leukocytes. Still got 8 minutes. White blood cells, 7,000 to 10,000 cells per micrometer. I wonder why this doesn't tell you the size. It tells you the size. One of the questions that was on the CPC was what's the smallest living thing in the body, and everybody kept getting it mixed up with the eye, and then it was either the eye or the cell. It's actually the cell. But we're going. This is a good part. I want you guys to continue to read this part. But when we finish with class, I'm going back over this subject just for me, that I want to go read this whole thing. Okay, but I want you guys to also read it. Okay, hemoglobin, uterine, iron, amino acids, which you guys already know about. I know you do because some of you who are taking this class have already taken medical terminology. So you guys actually already know what's actually in this class. But this is where we are. You have to still study this because on your CPC, they may start asking you some of this stuff. They'll ask you some of this, and you do need to know it, okay? The plasma, the liquid part of the blood consists of water, dissolved proteins, nutrients, waste, salt, hormones, lipids. You know how like people have plasma centers and sometimes they, go and donate their plasma. I can't say it, plasma. Okay, edema. You know what edema is? It's swelling. Let's read it. Some people may not know what it is. I can only read the first two sentences. I can't read the rest of it. Edema results when too much fluid from blood leaks out into tissues. This happens in a mild form when a person ingests too much salt. Water is retained in the blood and seeps out into tissues. That's in parentheses. And in a severe form, when a person is burned in a fire. What the hell am I doing? They threw me off with the fire thing. Okay, so we're not going on with the fire thing. The gist of it is I got a minute and change left. I'm going to finish going over the blood system the next time we do chat. But I want you guys to study that, okay? I want you guys to still study that. Even though we're over, I'm not talking about no fire and all that. We talk about swallowing and edema. If I eat corn oil, my feet go boom. If I eat corn oil, okay. So I got to put my shutters down. It's like dark outside now. Okay, yeah. So that's what I want you to do. Okay, you're gonna do cells, erythrocytes, blood, plasma. Okay, and again, that's in your summary. I'm on a summary with it. Okay, I think they got diabetic in here, dialysis in here. Dialysis should be in here. They're gonna show you. I want to keep moving on because I gotta remember what page I was on. I'll probably do it again tomorrow. Hopefully, if I get back in, where we at 478. So before we go over the lymphatic system, I'm gonna go finish the blood system. Okay, but that's for you guys' homework tonight. Make sure you guys finish that chapter on the blood system. It's very important, and when you start reading, it'll be very interesting for you to read. Okay, so we enjoyed the chat. You guys have any questions, you guys make sure you send me an email. Go on Amazon.com. Make sure you guys get that book. I know what I got to do. I always think of something I got to do when I'm on chat. I'm going to try and get in on that Monday chat tomorrow. I think so. I think I'm going to try to get off early. We're going to get that chat in. I have to make some changes with these people because it is cutting into my time on YouTube. I want to make sure you guys get what you need to get. But I'm gonna try to get home early. Sometimes I get in like 5 o'clock. I'll try to get here by 4. so I can make sure I do the check with you guys. So we are going to finish the blood system tomorrow. Let's hopefully we can finish it tomorrow. But you guys can go over this chat and make sure you get the erythrocytes down. Make sure you know what plasma is. Make sure that you understand everything about the blood. Not that you have to be an expert, but I want you to make sure when you take that test and they say what's plasma, what was it? It's 55% of the blood, right? 45% of red bloods, right? So no, it's 55%. I'm just giving you the 45 of the other red. But again, those are things I want you to study. Okay, so it's dark outside. I can see straight outside, so I know they can see straight in my little room right here. Okay, so I will see you guys next time. We're gonna shut this down. I'm gonna shout out you tomorrow. If I do not, it'll be the next day. So everybody have a good night. I'll see you next time.